video today. My topic, how I passed NCLEX in less than 30 days. It's record time, okay? And I was fresh from home. I had never seen an NCLEX textbook. I had never revised an NCLEX or anything. To be quite honest, I had not read. All right, all the information I had is from my university, from my bachelor's degree and clinical experience. Now I had some clinical experience and I'm sure maybe that helped. But I'll be honest, we are talking about someone who was completely fresh, came to the United States August 9th, okay, did the exam, I think it was September 16th. So, this is completely fresh. Like, I'm not even joking, all right? No, I had never seen any book, no NCLEX book. So this will apply to most of you, regardless of your profession. Regardless of your profession, this will apply to you. Because it's just a way Americans set the exam. All right, professional exams, they just have they have something they're capturing. They don't like to capture memorization. They want to capture understanding, and also they want to capture to make sure that you are safety. For us, the biggest thing in nursing is safety. They want to make sure you get the idea. So anyways, I will tell you real quick how I passed the NCLEX in less than 30 days. Wait, Hadija, welcome. Hadija, welcome on this video. I know you're tired of looking at Janet, but welcome. I'm waiting for you, Hadija, wherever you are. And Mercy, welcome back. So anyways, how I passed the NCLEX. So, as I said, when I came, my papers were ready to sit for the exam. So this is what I did, my schedule from morning through evening. So don't think it was any easy, all right? I went with Kaplan, for those who want to know. I know the people that watch NCLEX, NCLEX videos always want to know if it was Kaplan or not, okay? Now, these days, we have a lot of different books. Thank you so much, Hadija, for showing up, all right? I appreciate that. So there are many books on the market. And I always tell people, it's not about the book. Winfrida, thank you. Amazing content, thank you. It's not about the books. It's about the concept. You have to understand the concept. I'll be honest. When you understand things, memorization becomes easy. Okay? Memorization just becomes easy when you understand things. And so I will tell you how it happened. So I bought the Kaplan books. Mercy, thank you for coming back. I was mentioning all your names and you came back, okay? But feel free to leave. This is not your usual time. I'll post this video for you for now, for later, Facebook, YouTube, everyone will see this video who is interested in NCLEX. And it's not just for NCLEX. Some of you are coming, watching my videos. You'll come and change to nursing and you'll remember this video, okay? Before you do nursing, the other exams you will do, okay? Language exams, obviously different, but professional exams, there's something they are looking for. And you can read all the textbooks you want. As I said, I didn't even have a textbook. So you can go read textbooks and think you're very smart, cover to cover, and end up failing. In fact, let me be bold. Let me be bold and tell you the truth. Having lived in this country and done many exams and passed, by the way, I will tell you, you are more likely to fail. But if you are that smart, you're good at taking questions and answering questions, and you've had a background and how people answer questions, you can pass. Because the whole thing is actually how to answer the question. Okay, write that down. Okay, the secret is, how do I answer this question? Okay, number 2, what is this question looking for? So you can go read all these books, memorize all these things, but they are not going to come in the exam. Or they will come, but you'll not be able to answer or to relate or to put it in practical situations. Okay, so the whole goal is understanding the concept and knowing why they're asking you that exam. Believe you me, by the time you start doing these professional exams and you do an exam and you don't know what the question is getting at, you are more likely failing. Honestly, by the time you're ready to pass an exam, you kind of have an idea why they're asking you that question. They are looking for safety. They are looking for priority. They are looking for assessment. They are looking for evaluation. They are looking at a concept which might need memorization. Maybe there's just that one drug that everyone needs to know. What are the dangers of that drug? And that will require memorization. So for me, let me start with my story, then you will understand. So once I got the book, which I said it was Kaplan, for you these days you have UWorld and you have all these other resources. Pick one book, stick to it. That will be my advice. In any exam you do. Thank you so much, Mabel, for coming back. Any exam you do, choose one book. First of all, Understand that book from cover to cover. The mistake people make, oh, what are you using, Kaplan? What are you using, UWorld? And then they come jumping back and forth, and then you get confused because every textbook has a different way of approaching exams. And so you are using the concept from this one. You are using the concept from, they are trying to say the same thing. You understand? But if you stick with the one, you stick with the same format, in fact, you'll be sitting in the exam and you'll be seeing that page where you read. It's just a way of organizing your mind. Now, if you finish one textbook and you feel like now you need to move to the other, then be systematic. Don't be mixing. Well, that is my advice and that is my opinion. I would rather read from cover to cover, understand what this book is saying, go through that 3 times, then do the test exams. Once I do the test exams and I'm constantly getting above 85, then I know I'm ready. Yes, 85 normal in America is normal. We get those. Okay, we pray me soon. Thank you so much, Mabel. I pray for you to pass these exams, okay, and to stick around here. Now, you read from page to page. That's what I did. And when I say reading, and you say, but Janet, you say you read all these textbooks and you will not pass. Listen to me. I took a textbook that has, for references, number 1, put it on the side, but took the one that has questions and answers. If you want to pass exams, listen to Janet. And I know some of you are very smart, okay? You just love reading books. Me, I don't. Okay, me, I don't. By the way, just because I'm educated does not mean I like education. I don't like education, but when I do my things very well and I pass, people think I'm very smart. I don't like education. It's not my thing. I don't like. But when you tell me that if you do this, you will pass and you'll get this license, I will do it. Okay? But if you're one of those people who likes books, please understand you have to learn the questions. Okay? Now, for me, I woke up for breakfast, okay? Did questions. Went lunch, came, did questions. Went dinner, did questions. Went to shower, questions. Toilet, questions. Eat, questions. Wake up, questions. If I find a concept that I'm not understanding, I'll go in the book and say, what are they trying to say that I'm not understanding? As a reference. But the good news to the questions, know why you are answering that question. Number 1, as I said at the beginning of this video. And each question gives you a rationale. Why you are right, why you are wrong. Why you are right, why you are wrong. Okay? Understand what, and you have to know why you are doing that exam. You have to know why you're answering that question. And that's why you see people have done NCLEX 2, 3, 4, 5 times. They have not reached that level where they understand what the exam is looking for. Most of these professional exams, they are safety exams. Otherwise, they will just leave everyone to graduate campus and go and start working. The reason they license is to kind of make sure that everyone graduated from all these schools, you're kind of speaking the same language. So they test concepts. They don't test, well, knowledge too, but they want to know that you are a safe practitioner. They want to know you are a safe nurse. And so now let me go to the specifics. Okay? Sorry if I'm boring for those who are not in the nursing, but borrow that for your profession. Okay? There's something called the nursing process. Okay? Where there's assessment. Okay? Once you assess, you do, you plan, and then you implement, and then you evaluate. So a question will ask you about an assessment skill, and the answer should be assessment. So if you answer evaluation, you're failing. So you need to know, is this trying to assess my level? Do I know how to assess the lungs? Why is this question? Okay? This one is trying to assess my skills in evaluation. What kind of plan should I make? Yeah, so that is number 1. You have to understand the nursing process, period. Every question is dancing around that. Not every question. Many questions are dancing around that concept of the nursing process. So if you don't understand, you are in trouble. Okay? Number 2, priorities. Again, I go back to safety. You have to know how to prioritize things. You come in the morning, you take report, you are so busy. This one needs blood, that one needs oxygen, this one. What are you going to do? Delegation. I'm going to delegate to the nursing assistant, to the medical assistant, or I'm going to call X-ray to handle that. Yes, delegation is part of priority to save time. Okay? If a patient is bleeding, you are not going to take care of the patient that has pain. Okay, so what is the question testing you? It's telling you that the patient that is bleeding comes first. The one that is in pain or the one that is asking for a bedpan to use the restroom is last. So you have to know when to prioritize, which patient comes first. Priority, priority, priority. Let me get those out of the way. Okay? Now, you have to know leadership. Leadership. You have to know research. Okay, so you need to understand which medicines are used the most and why. That is evidence-based. Why are you cleaning wounds a certain way? Okay, why are you preparing patients for surgery a certain way? Because the evidence has shown that if we do this is the outcome. So sometimes when you hear research, some people get scared. Oh, they are going to ask all these research things. And no, the concept, understand what the concept is. Okay, once you understand the concept, okay, you will not even memorize. Do you understand? Now, these are just some of the things that I did. And having done many exams, I know that's what they are looking for because I always pass those exams. Yes, and I have all those licenses. I have an RN license, which I maintain. I have family nurse practitioner license. I have psychiatric nurse practitioner license. Okay, and by the way, for your information, there's a time I wanted to go for medicine and I did the medical exam, the MCAT. So I know what I'm saying. Okay, I've done so many exams, but again, I don't like school. Right now, you know, like I have 18 months to finish PhD, but you're not finding me in any school. I'm asking myself, why am I going to do this to get my PhD? Because I have to see the value. Okay, but some people, they are very scholarly. So if you are one of those scholarly people, stick around because this is your video. Me, I'm not. And many people are shocked to hear when I say that. No, me, I'm not. I'm not into books and I don't like them. In any case, I don't. Okay, I just try to survive. Now, the most important is this. Do as many questions as humanly possible. Let me repeat. Do as many questions as humanly possible. All right? Tell yourself, I have to be doing 200 questions per day and stick to that. Okay? Do as many questions. And let me tell you quickly my story. I have my sister-in-law came, passed the NCLEX in India, came, brought my brother and the kids. Janet, what do you think about the exam? I said, listen to me. Do as many questions as possible. And then when it comes to the testing, when you start testing yourself, if you're scoring below 85, you're failing. I mean, I scared her, but you know, it's the truth. Don't fear self-testing. Okay, this is another thing. I will save you time. I'm going to keep this video short so you don't have to worry. Some of you are too scared. So you think, you know, when you start the questions, you start testing yourself to see how much you know. I am not doing that. Now you do that. Again, this is my style. And I've passed all these exams, okay? This is my style. I have no time to test myself. Give me a book, I just go straight to question and answers. Shortcuts. Me, by the way, I love shortcuts sometimes. Okay? I am not sitting there to test. You will get a 30%. What are you going to do? You will get discouraged. And then you will waste time. Me, I start with page 1. I say this today I'm covering cardiology. I'm going to be reading and question, answer, question, answer, question, answer. By then, I'll test myself to see, did I know this or no? But I'll know why I was right, why I was wrong. Why I was right, why I was wrong. Once I finish the cardiology, then maybe I can test myself without looking at the answers to see how much I've grasped. And I'll do that over and over and over again until I finish those questions. My textbook, when I started reading for Kaplan, I read from page to page. In fact, not textbook, the questions. I read the word Kaplan. You know how it's written in white? I read it. I even went and see which company publishes this. And then I saw it was produced which year. Okay? And then I went to the disclaimers. And then I went to the preface. Like I never left any stone untouched. Okay? Now listen to me. After we've done as many questions as we can. Okay? This is where people, some of you who fail. First of all, you did not understand what the question was asking. Why? You did not understand the process, nursing process. You did not understand safety. You did not understand prioritization. But the most important, you did not understand what the question is. Why? Once you know why, you are passing the exam. You've reached that level of passing. And the exam knows. Do you understand? Now, some of you, you think now you finished, now you are good. No. You have to do that textbook, and I mean 2-3 times. 4 times if that's what it takes. Until you start scoring constantly above 85%. That's just the truth. That is just the truth. There is no shortcut. There is nothing you can do about it. If you're testing yourself and you're getting below 80, okay, you will panic. You will panic. So that was the preparation aspect. Okay, I put in time. I did as many questions as humanly possible. I understood why I was right. I understood why I was wrong. I understood the nursing process, and I made sure, okay, the risky things I know. There are those risky values that you can never afford to know, and yes, you have to memorize. You cannot be a nurse and you don't know what a normal hemoglobin is. You have to know your normal potassiums. You have to know your normal sodiums. Okay, you have to know the common heart rhythms. Sorry to go technical. If you are a nurse, they expect you to know sinus rhythm, and they need to know a flat line. We all know flat line means the patient is dead. But before the patient dies, you have to know the most common. No one is coming to test you necessarily for her first degree heart block. Maybe they do these days. Second degree, third degree heart block. No one is testing you, but yes, sinus rhythm, you have to identify the sinus rhythm. The QRS, you have to know. Those are basics you have to know because they have to do with safety. Because if the patient is on a heart monitor and you see that, what is going to be your interpretation? To call the doctor, give the medicine, turn them up, give oxygen, do something about it. So that's just as basic as knowing the hemoglobin and the iron level. Okay? Those ones you have to know. Now, do not waste time and go into the complexes of heart blocks. Sinus rhythm, sinus bradycardia, sinus tachycardia. Okay? Atrial fibrillation, you have to know. Ventricular fibrillation, you have to know. And you have to know a flat line. Okay, the things that will make a difference if the doctor is not there, what are you supposed to know? You have to know those. Okay, you have to know the normal lithium. If a patient is taking, you have to know the normal Depakote, things that will cause liver disease or liver failure or kidney failure. They will test you on those, and those you have to memorize. Those are the only times I feel like you have to memorize these things. When there's something you really have to know. Okay, you have to know the normal creatinine level for the kidneys. So there are those common level. I'm not going to, or CHF. Cardiac enzymes, you have to know your cardiac enzymes. What is our normal cardiac enzymes? You have to know your liver. What are the normal, like those things you will need to notify the doctor when he's sleeping. That's how you think. And that is what the exam is testing. That is why the exam is testing you on prioritization. Like if a patient is asking for pain and the other one is bleeding, why are you not telling the nurse assistant to go calm down the one in pain and tell them you're coming and go deal with this other one? That is, it looks like it's a simple concept, but they are testing you. Okay, on the nursing process, on the research, all those things. Okay, they are testing you to be a safe provider. They are testing you that when the patients come in the hospital, they are in safe hands. These are standardization exams so that if you're in New York, and you're in Miami, you're speaking the same language. Even if you went to different schools, that exam makes sure that it's the basic entry-level exam to make sure that they are graduating safe patients. Which, if you ask me, we should be doing that worldwide. Every profession here has those standardization exams just to make sure everyone is speaking the same language. Okay? So that is what I did. That is what I did. Now, that is preparation. If you have any comments how you passed, please share. But let me go to the second part quick before I close this video. Okay? Preparation takes a lot. Now, that is where you get the content. You have to know why. But now, on the day of the exam, some people prepare, and then on the day of the exam, they don't believe in themselves. I've met people who are just too scared. Me, I walk in the exam as a champion. I walk in the exam and I don't overthink. I tell myself, this is it. This is it. And you know my days, they used to give us 3 days. These days, you wait. I don't know about your exams, but most exams that I've done recently, after you are done, the computer shuts off. Okay? Stick around. I'm going to tell you a quick story before I go what happened to me. When the computer goes off, okay, you're panicking. You're thinking of that when you should not be thinking. Me, I'm going to just present my best because dress well. Here we say dress in layers. By the way, this top, I don't know why it's cold. But I love it during the cold season. So that's why you see it in many videos, okay? Dress in layers. They will teach you all those things and you take it for granted. No. You might enter the exam room and it's cold and you start feeling like you need to use the restroom every minute. It's better to have inside a light t-shirt, another maybe sweater, and then a jacket. So you can just be removing. Okay? Another thing is don't drink too much coffee. Sleep well. The night before, sleep is very important. Control your anxiety. Sleep very well. Eat light. Do not overdrink water, but be well hydrated. But everything will come down to your mindset. Because if you don't read like at 4 o'clock, If it's an exam you've been preparing for a long time and you wake up at 4 to read, you are not ready. More than likely you are going to fail. Oh, sorry, Janet. I didn't mean to say that. By the time you have 2 to 3 days, you should be ready. So what do I mean? Don't wake up at 4 to read because you forgot to read something. Trust in what you have and go. Okay? Believe in yourself. Have a strong mindset. When you sit on that computer, you fight like a lion, my friend. You fight like a champion. Like Janet Rangi, I fight everything in my life like a champion, like my life depends on it. And I'm here, pass or fail, I'm presenting my best behavior, my best. Because that's all I know. There's nothing you can change if you wake up at 4 other than mess up your sleep. Okay? The confidence level helps to take you through those exams. The temperatures will be set in there. The cameras are watching you. You can only have 1 or 2 breaks. So you have to do all these things, okay, very seriously. Do you understand? Okay. Now, having said that, I will conclude with what happened to me while I passed. Okay. For those who've done NCLEX, I don't know if they changed these days. It's been a while since I did that exam. But they used to tell us the exam is how many hours? 5 hours. And nowadays, they would say, the computer can stop at 75, which maybe is 2 hours or wherever, 1.5. It means you're too good or you are too poor. Or it can take you all the way to 5 hours. It means you're too good or it means maybe you're poor and maybe you're too good. Me, I don't know. Okay? So now many people, I finished within a few minutes, the computer went dark. It means maybe they passed, okay, or they were just too poor. Because the computer is designed to choose one question and twist it. So just because they asked a question about lithium and you failed, they are still believing maybe it was you forgot. So they twist it another way. Once you fail it, they're like, she didn't get that one. Point down. Then they go to another subject area in cardiology. They test you one way, you pass. They keep going. Then they go to priorities. They say, good. They give you 2, 3, twist it. You're getting, they know you get the point. That's how exams are set in America. Are you learning something? Are you learning something? Are you learning something? So you should be thinking like that. Okay? Having said that, because Janet came from home to America, has never seen any textbook, has never learned about NCLEX, has never learned about CGFNS exam, which our days you had to do both exams. Okay, except New Mexico and Nevada. Guess what? Janet chose Nevada so that she can avoid CGFNS. So me, I only did NCLEX. So I only have 14 days. For your information, my stomach was full. What am I mean? 9 months pregnant. Mothers listening to me, 9 months pregnant, and I'm conquering the NCLEX. Okay, when I was reading, I was just telling God, dear God, please do not bring labor pains. That was my prayer. Every time I feel something, I'm like, oh Lord, please forgive me. Let me just keep that baby inside, please. When I done the exam, feel free. So now I go to the exam room, 8 months pregnant. Okay, I sit on the computer. Remember, there's a break. I think there were 2 breaks. They'll tell you to go to the bathroom. I'm telling you, I'm still in the topic and I'm about to finish. I told you to still stay until the end. So I tell you this story. To me, it's the most interesting, which I think made me pass. It made the difference between passing and failing. I looked at that computer. I did my little prayer. I prayed not to have labor pains. I relaxed. Took a deep breath. Take a deep breath. Okay? I started. Okay. That woman put the cameras. Scrap paper. Bye. See ya. I started. When you look at the exam, on the corner, they tell you the time and the questions. Coordinate those two, my friends. Adjust your speed. Some of you, I came so close, but I didn't answer 10 questions. Me, I prepare all that time and I come and do that kind of nonsense in my exam. I am not doing that kind of nonsense. Not finishing exams, it's you to blame. It means you didn't practice enough. You have to practice before. That's another thing I forgot to tell you in the video. You practice before you go there to know your timing. So I was just looking up and down. Okay, this is where it became interesting. Okay, now I have more questions than the time. I speed up. I am fighting with this exam. They test me this, I fail maybe. They go and test because I was not prepared, but I did my best. Remember, it's less than 30 days, record time. Even the ones who are trained in America, they sometimes they fail. In fact, many fail, many pass, but this was record time, having not gone to school here, having never seen a textbook. So I'm fighting like a lion. Okay, so I'm doing, I do. I finish. I'm going to finish this exam. Do you understand? I finished that exam in the middle, let me back up, okay? In the middle, do you want to use the restroom? You can now have a 5 or 10 minute break. I went straight, no. I kept on going, okay? Until it reached a time where the number of questions was matching the number of time, the amount of time remaining. Then it reached a time where now I started having some extra time. This video is very important. I hope someone is listening. This is what will make you pass, not reading those books. Everything that just Janet said now will make you pass for any professional exam, I'll be honest. When I reached the last question, I had like 2 minutes left. So I did not have time to revise. And by the way, every time I talk, I remember points. Don't change answers unless you know that you're sure. Anytime you change an answer just because you think, you will regret. The only time you answer, you say, oh my God, that was a free point. I can't believe I chose the wrong answer. That's why it's important for you to repeat, go through your questions, not to change, but to make sure that you did not fail an obvious thing. That is the only time you change. If you know the answer and you want to slap yourself for having used the wrong answer. Okay, that is the only time you change. The rest, guess what, keep going. And by the way, if it reaches a time and you have 2 minutes left and you have 5 or 10 questions left, guess all of them. Don't leave the exam without completing the exam. If you guess 10 questions, you might get 2 right, and that will make a difference. So for me, since I was not very prepared because of time, and by the way, I did not prepare because I was pregnant and I had come from home and I had no one to take care of my child. And I told my sponsor, book me this exam. Oh, Janet, we have nurses from all over the world. They are very smart. They are coming from India. They are coming from the Philippines. They've been here for 6 months. They were very good friends of mine from the Philippines. I loved them. And they've been struggling. Okay? And it's better for you to take 6 months and learn. And here is this woman here called Janet is calling the sponsor and telling the sponsor, Janet, you just came to America. Yes, I know. But I didn't tell him I'm pregnant. I'm putting myself together. Obviously. I'm putting myself together. But he didn't know that. Okay? Me, I'm like, once I pass, now they will keep me around. I have everything in my pocket. So I struggled. So I think that computer was doing, she's good. No, I'm not sure. Give her another one. Yes, good. Do you see why it was important for me to struggle till the end? I think the computer was going like this, until by the time I finished, it was... Anyways, I finished the exam. As I said in the beginning of this video, it used to take about 2 to 3 days before you get the results. So I left the room for the first time, and the lady was out there. Hi, Janet. Oh, the baby. Are you okay, honey? This Caucasian lady gives me candy. Eat some candy. I say, yes, give me some candy. Then she went and called this driver from Japan, and then the guy came and took me, the ride. She told me one thing. She said, Janet, I've been doing this for many years. And I will tell you something. You never turned out of that screen. Your head was razor focused. She said, I never even turned right. I never turned left. I did not scratch my head. Maybe I did not blink. No, but of course I blinked. So I left. Guess what? 3 days later, I've forgotten me. I'm having fun with my Filipino friends. Janet, you did the exam. I said, yes, I had no choice. Look at my stomach. Okay? Yeah, okay. Then this teacher comes, English teacher. Where's Janet? That's what took me to America. I did that video and most of you liked it, but those were many days ago. That's for another day. Janet, you passed the exam. Oh, you're the sponsor from Ohio called and said you passed. She was hugging me. Her face was turning pink. That is how I passed. All my friends from the Philippines, Janet, what did you do? How did you do it? I started basking in the sun as I wait for my baby to come. And that is my American story. Okay? My sponsor was she said, Janet, I am flying. Okay? He even brought the boyfriend. Okay? He was a man. He was gay. Okay, he said, Janet, obviously you can see I'm gay. I say, what makes you obvious? Okay, you don't like women? I no, I don't like women. This is my boyfriend. Okay, but I'm bringing him here to show her who is this girl from the Sunshine Continent that has come just recently and broken records. We had to come and see you, Janet. I say, yeah, look at me head to toe. This is me. Yes, and now you see my belly. Do you understand why I was? Oh, now I understand, Janet. Now I get it. Zoom. They drove me, packed my things, took me to New Jersey. That is where the hospital was. And they told us, the hospital, Janet passed. The hospital brought in the lawyer. They say, Janet is here. We are going to change immediately from student visa to green card. And that is my NCLEX story. When you know what you want, okay? When you are pushed to the limit, the brain can take you places. I hope you enjoyed this video. Merci beaucoup. Muchas gracias. Asanteni sana. I can't wait for you to pass all the exams. Now Janet has told you all the secrets. You do this, you're passing. Don't waste time with textbooks. Do million questions. Know why you are right, know why you are wrong. Know why the question, if you go to NCLEX and you don't know why you are being asked that question, you are not ready. And it takes practice. Okay? Thank you so much. Kwaherini, asanteni, zikomo. I love you so much for always coming. I will see you in the next video. Okay? Thank you so much. Bye-bye. Love you for following.